You may have heard that counties across Oregon are beginning to reopen businesses and services that were closed due to COVID-19. This is because our work to flatten the curve has worked so far. Some businesses, such as restaurants, gyms, hair and nail salons, may start to serve people again, with social distancing and other safety measures in place. The governor's Stay Home, Save Lives order is still in effect in some counties. So for most of us, we need to stay home unless we need to go out for work, groceries, or medical treatment. If you must leave your home for an essential activity, please protect yourself. The virus is thought to spread mostly from person to person, between people who are close together. We all need to take a break, get fresh air, or exercise. Brainstorm safe options for the things you enjoy. While staying home is not always fun, studies have shown that people with intellectual and developmental disabilities are at higher risk of bad side effects from COVID-19, including pneumonia. We all have friends and loved ones who are at risk. For that reason, even as counties start to reopen, the Office of Developmental Disability Services is recommending that through the first couple of phases of reopening, you do your best to stay home. The governor is allowing a slow reopening of businesses across the state, but not all counties and businesses will be opening at the same time. If you live in one of the counties beginning to reopen, it's natural that you'll want to get out after being cooped up for several weeks. Please remember, the virus is still present in our communities, and the best way to prevent illness is to avoid being exposed. Prior to leaving your home, please consider talking to someone you trust about the risks. This might be a friend or family member, or someone who provides you with support. It would be good to have a conversation about the risks of going out, and if you still decide to go, how to stay safe. Here are 7 things everyone should do to help prevent the spread of the virus. Wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place. Also, wash your hands after blowing your nose, coughing, or sneezing. If soap and water are not available, use a hand sanitizer. Cover your hands and rub together until they feel dry. If you leave home, make sure to wash your hands as soon as you return home. Some people even plan to take a shower and wash their clothes as soon as they return home. Wear a cloth face cover when you must go out in public. Remember that a cloth face cover is not a substitute for keeping your distance from others. Cloth face covering should fit snugly but comfortably against the side of the face, be secured with ties or ear loops, include multiple layers of fabric, allow for easy breathing, and be able to be machine washed and dried each time they are used. When removing cloth face coverings, be careful not to touch your eyes, nose, and mouth. Wash your hands immediately after removing. The Centers for Disease Control website has ideas for masks, including options for people who do not sew. Create a few for yourself so that you can carefully remove and wash after each use. The link is provided here. Go out when there are not as many other people out. Some people shop for food right before the stores close or right when they open to avoid times when a lot of other people are shopping. Avoid close contact with people who are sick, even inside your own home. If possible, stay at least 6 feet away from the person who is sick. Do not gather in groups in your home or in the community. Cover coughs or sneezes, even at home. If you are at home and do not have your cloth face covering on, remember to cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash and immediately wash your hands or use a hand sanitizer. Everyone should clean and disinfect often touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. Let someone you trust know when you're not feeling well. Here are some final reminders. Stay home if you're sick. If you're at risk, have a disability, or are over age 60 or have other medical conditions, you should stay home, even if you feel well. Practice good hygiene, including hand washing, hand sanitizing, covering your coughs, and please don't touch your face. Practice physical distancing. The danger of this virus has not passed, but with proper care and caution taken to protect yourself and others from the spread of the disease, we will become stronger together.